Have you ever noticed that when you're in pain or you're bracing for pain, you start to hold your breath or breathe really shallow and up high in through the chest? How you breathe can have an impact and an effect on your pelvic floor because they work together as a team. And if you're holding your breath or breathing shallow, it can actually make your pelvic floor condition worse. I'm Amanda Olson. I'm a doctor of physical therapy and a certified pelvic floor rehabilitation specialist. And today I'm going to walk you through breathing mechanics and how to do a simple breathing exercise that actually helps. When you're in pain, especially pelvic pain, the body often adapts a shallow breathing pattern, really high and in the chest and not deep breaths. It's often a subconscious attempt to avoid any movement or disturbance in the abdomen in the pelvis. But over time, those breathing mechanics can actually start to drive more pressure on the pelvic floor and can over time drive more problems. The other habit that's really common that I see in a lot of my patients that are experiencing pelvic pain is breath holding. You'll know you're doing this if you find yourself doing deep sighs, or somebody next to you might ask you what's wrong because all of a sudden you've had a deep sigh. You might also notice tension in through the front of your neck and in through your jaw because of some clenching habits and behaviors. And again, none of these are on purpose. It's just something that happens subconsciously. And part of the healing process in pelvic floor rehabilitation is breaking those patterns and learning to adapt a solid breathing mechanics pattern so that you don't further drive issues in the pelvic floor. Here's how the pelvic floor and breathing are related. Our diaphragm is the muscle that we breathe from, and it sits at the base of our rib cage. When we inhale, it drops down, and so does the pelvic floor. And then when we exhale, it rises back up. So it goes in and out, very similar to a piston. So this is why we cue people who need to strengthen their pelvic floor to inhale, relax, exhale, contract the pelvic floor. For those that are experiencing pelvic pain, it's the opposite. We encourage them to drop down a little deeper on that inhale. There's some verbal cues that we can use to enhance that, like imagine the pelvic floor is an elevator sinking down, or imagine that you are a trampoline and you're sinking down into that trampoline. But this breathing mechanics here is the nature and the science of how we breathe. And it's why breathing properly in through the abdomen and learning to expand the pelvic floor is really important to manage pelvic pain. Let me walk you through that breathing habit right now. Lie on your back with your knees bent and your feet planted. If you'd like, you can place a pillow underneath your knees and let them relax down straight to help take the tension off of your back, or you can place a pillow on either sides of your knees. And then you're going to place one hand on your belly and one hand on your chest. The goal here in this particular exercise is to try to enhance the movement underneath the hand over your belly. So you want to imagine that as you inhale, the belly is inflating in 360 degrees like a balloon, expanding up and out. And then it's just going to gently settle back down. So we're going to do a few breaths. So inhale, 2, 3, 4. Exhale, 2, 3, 4. If your abdomen feels a little stuttery as you're trying to inhale and you feel it kind of jolt a little bit, that's really normal when you're learning this new behavior. Your brain and your muscles are saying, are you sure it's safe? Are you sure it's safe to expand? And with practice, they're going to learn this new movement of expansion after having guarded and gripped to try to protect you subconsciously. So this will take time. It takes practice. And if you have any scars in your abdomen from surgeries or injuries, be sure to check in with your pelvic health therapist or your healthcare provider. There's some gentle massage techniques that can be done to soften those to help better enhance the mobility in your abdomen. If you're using vaginal dilators, this breathing pattern and breathing exercise is the foundation of dilator training. And this exercise in particular can be the warm-up to do prior to starting your dilator session. I have full guides on how to use the dilators, and we'll link that here in this video. Breathing is truly the most underrated tool in pelvic health. It is the foundation for how we live, and it's also mechanically tied to pelvic floor function. If you're experiencing pelvic pain or other types of pelvic floor issues, be sure to take a look around in this channel. We have so many guides and assistive videos to help you. And if you have any questions, be sure to drop them here and we'll get them answered. And I might just use these questions to make further videos to help provide more education.